Welcome to Monday's edition of COVID-19. I'm Min San Hee. We're starting the new work week with the daily tally at its lowest in about 40 days here in the country. And President Moon Jae-in has pledged continued support to fight the pandemic during his New Year's address earlier this morning. Now, this comes while the world's tally has hit over 90 million cases. I have Kwon So-ah standing by with the broader pandemic update. So, to start us off with the situation here in Korea for this Monday.
Sure, Sunny. We are starting off with some hopeful news this week. 451 cases have been confirmed as of 12 a.m. this Monday, and that's the lowest number in 41 days. So since December 1st, meaning before the situation developed into the worst domestic wave of the coronavirus here. Now, since Friday, the country reported daily cases in the 600s, and now we're even dropped to below 500. And also, when we compare the number to last Monday, we had almost more than double the amount we have to date. So that is an improvement. And with that, the tally here in the country stands at 69,114, the death toll at 1,140 with 15 fatalities added. And the average number of cases in the past week has dropped to below 700, with domestic transmissions at around 655. And given this downward trend, officials are in deep discussions on how to revise social distancing measures past January 17th, as current measures have been affecting business owners for too long. And that especially in the metropolitan region, which is under level 2.5 social distancing measures. But the numbers are looking much better than last week. 141 cases in Seoul, 147 in Gyeonggi-do Province, 22 in Incheon. And we also have cases from abroad, which stand at 32 this Monday.
Right, so, and as I mentioned earlier, President Moon touched upon the pandemic during his New Year's address early this morning.
That's right, Sunny. And what caught the biggest attention was his promises on the vaccine front. So let's take a listen.
다음 달이면 백신 접종을 시작할 수 있습니다. 우선순위에 따라 순서대로 전 국민이 무료로 접종받을 수 있도록 하겠습니다. 자체적인 백신 개발도 계속 독려할 것입니다.
And President Moon also vowed to publicize developments on the domestic treatment front in a transparent manner. Now, although vaccinations are already in full swing in some countries, the global situation is not slowing down. The global tally has surpassed 90 million over the weekend, and we are seeing over 500,000 cases day by day. And if we take another look and speak at another variant that appears to be different from the strains in the UK and South Africa, has been detected in Japan among travelers from Brazil. Speaking of which, we are going to connect later to Brazil, which now has over 8.1 million infections, and the death toll stands at past 203,000. The U.S. is close to 23 million infections now, and the UK has hit the 3 million mark over the weekend with over 54,000 new infections. And we also see the Czech Republic has become the country with the 20th highest number of infections around the world. And those are the updates I'll have for now. I'll be back in a bit after the government briefing. Sunny?
All right, so thank you for now. Right, staying on the international front, Brazil has been witnessing its death toll reaching record highs in recent days amid conflicting COVID-19 responses among government officials. I have Luana Ferreira live on the line with more on the situation there. Welcome, Luana.
Thank you for welcoming me back, Sunny.
Right, Luana, as we just reported, well over 200,000 people have lost their lives to COVID-19 there, and Brazil now has the second highest death toll after the U.S. What appears to be driving this deadly phenomenon, and how severe is the situation there?
Well, Sunny, there isn't just one answer for that question. But the situation in Brazil is indeed very serious. As you mentioned, we have over 200,000 deaths, and in December we have an increase of 65% of the number of deaths due to COVID. Of course, the behavior of the population is part of the reason for that, because people were going on massive parties in December for New Year Eve. But we cannot forget that the federal government in Brazil, plays a huge role on that. because there is a lack of proper measures to go against COVID.
And speaking about lacking, Luana, I understand there appears to be a lack of consensus with regard to facts about COVID-19, efforts to contain it, as well as vaccines to prevent it among the presidential office, relevant government bodies and regional governors. Please tell us more about this.
Yes, actually, since the beginning of the pandemic, Bolsonaro made the headlines all over the world because he didn't take the COVID seriously. We have heard the president saying that, oh, it's just a little flu. And a few weeks ago, he just said that he doesn't understand why the whole world is in a hurry to have a vaccine, because there is no need for that. In the meantime, the governors in Brazil, the governor of São Paulo, João Dória, he negotiated a vaccine with China, the coronavirus, and it became like a political tool for Bolsonaro, and it was like a fight between the two of them.
I see. Luana, I'll ask you about that in a bit, but first, what then is the public consensus on COVID-19 and the government's handling of the pandemic?
Well, when we talk about the people, it's difficult to explain because people seem to don't be shocked anymore when they look at the numbers. We have over 1,000 deaths per day right now, but people just seem to don't care anymore. And part of the population, they just went back to the normal life and social activities. And in the New Year Eve, for example, we have seen massive parties all over the country that last for 3, 5, 7 days. And now we see the aftermath of those parties with a sharp increase of the numbers.
I see. Luana, I hear Brazil itself is poised to launch its vaccination campaign soon, and this plan comes amid the recent disclosure of clinical trial results of a Chinese vaccine that you mentioned. Please do share with us the latest on the vaccine front there.
Yes, actually, yesterday, the Brazilian government, they announced that they made a partnership with the government of São Paulo, finally. So they will buy the 100 million doses that they have from CoronaVac, and they will make a national plan, and they will distribute the vaccine in the country. We don't have the vaccination plan yet, but they should start in late January and early February. And something curious that we heard is that a few days ago, the government announced that the vaccination records from Bolsonaro will become a secret for 100 years. So probably even the most passionate anti-vax in Brazil will have a vaccine after all.
I see. One final question, Luana, before I let you go. What is the public response to vaccines? Do you see a greater number of the population choosing to be inoculated?
Yes, actually in August, 90% of Brazilians, they said that they had no intention of taking any vaccine. But a few weeks ago, we heard that 29% of people will have no intention of taking any vaccine.
I see. All right, Luana, as always, thank you very much for making the time to join us live with your thoughts at this hour.
It's my pleasure. Thank you very much.
Right, well, it's time now for the regular briefing on COVID-19 here in Korea for this Monday. And while we wait for that to start, perhaps we can take a quick look at the stringent restrictions on gatherings for social purposes until this coming Sunday. That would be the 17th of January. Social gatherings of 5 or more people indoors and outdoors are banned across the nation. This ban has been in place in the metropolitan region since December 23rd, but has since been expanded to include the entire country as authorities step up their efforts to contain the latest outbreak. The only exception to this ban includes those who live together as registered in their official documents. Also, an exception to the restriction on gatherings is that related to business, as well as weddings and funerals, where the cap on attendance stands at 49 or fewer in the metropolitan region, but 29 for funerals here in capital Seoul. Under level 2 social distancing, the cap on weddings and funerals stands at 99 for those outside the greater Seoul area. Meanwhile, ski resorts have been allowed to open doors provided they place a 1/3 capacity cap on visitors and close doors at 9 in the evening. I understand the briefing is about to start. We'll come back to you afterwards.
허가와 관련된 내용을 같이 발표한 이후에 질의 답변 받겠습니다. 그럼 먼저
First of all,
정은경 청장의
We have Commissioner Chung Eun-kyung with the briefing on the COVID-19 situation.
네, 코로나 바이러스 감염증 19
Let us now begin our regular briefing on the COVID-19 situation. As of January 11th, Monday, we have a total of 419 new local infections and 32 new imported cases. The total caseload now stands at 69,114. Yesterday, we had about 28,000 people who were tested with suspected symptoms, and about 13,000 were tested at the metropolitan area's temporary testing centers, and a total of 42,000 or so have been tested. And we have 15,422 people in quarantine, while 695 remain in critical conditions. We had 15 additional fatalities. The death toll now stands at 1,140. And I extend my deepest condolences to the deceased and the members of the bereaved families.
네, 1월 11일 기준 국내 주요
As
발생
of
현황을
January 11th,
말씀드리겠습니다.
we have some updates on the domestic infections. Yesterday, we had 419 new local infections here in South Korea, and we had about 297 in the metropolitan area and 154 in the non-metropolitan area. And as for the details, please refer to the press kit that we have given you. And during the last week, we have made some assessment of the risk indicators. Here are the details, and we have about 773 cases of daily average, which is down by more than 100 from the previous week, which is about a 20% decline on week, and we have seen a 2-week straight week decline as well. And we have 35.1 of the imported cases on a daily basis for the past week. However, which is an increase from the previous week. However, it's hovering around 30 per day. And as for the details of each of the region, here are some details. And we have 654 local infections. And in the metropolitan area, we had about 400 and about 50 cases in Gyeongnam. And in Gyeongbuk, we have about 40 cases as well. And during the past week, we had a total of 158 fatalities. And as for the age group, those over the age of 60 were accounted for about 62%, accounting to about 101. And above the age of 70, we also had about 22%. And we can see that the senior age group accounted for the majority of the deaths. And as for the suspected routes of the infections among the fatalities, we have about 60% of them getting infected with the virus through the virus vulnerable facilities, including nursing hospitals, nursing homes, and long-term care centers. And as for the fatalities, we also identified that about 69.2% had underlying illnesses, and rest of these 6 cases, we are still conducting some in-depth analysis. And as for the sources of infection, we see that 41.5% of them were contact with previously confirmed cases, and most of them got the virus from family members, friends, acquaintances, and co-workers as well. And aside from them, we also have about 19.5% of cluster infections, and 9.5% were about 500 cases stemming from the nursing hospitals and other health clinics, and about 4.5 imported cases, and 25.1% which is under investigation. And as for new cluster infections, we had 10 new cluster infections. 4 of them were nursing hospitals, 2 were religious centers, and also 3 were business operations, and 1 being cram school. Lately, the COVID-19 trend is seeing a downward trend. However, we still have some risk factors lying ahead of us. First is the fact that there are still risks of local transmissions, and especially we have about 26.2% of the local cases are still under investigation, meaning unidentified sources of infection. Therefore, we still have some lingering of of the risks of local transmissions. And in the metropolitan area, we have the makeshift testing centers, and we will be carrying out these makeshift testing centers going forward, and we will do a midterm analysis as well very soon. So if you have any suspected symptoms of COVID-19, please visit these testing centers around the country so that you can get tested as soon as possible and comply with intensified quarantine measures as well. And second, we still have the trend of the outbreak stemming from virus of vulnerable facilities, including nursing hospitals, nursing homes, and long-term care centers. And at these facilities, it is very difficult to identify the patients at an early pace. And also, we have difficulties in responding to the virus infections and a possible massive cluster infection. So as for nursing hospitals, we will be carrying out shortened regular testings, and this will be carried out weekly basis for all of the people who are staying at these nursing hospitals. And as for the staff members working at these facilities, we are asking for them to also comply with more stringent social distancing measures and quarantine measures. And if an outbreak breaks out, we will be dispatching emergency response teams as well. And as for the correctional facilities, we will be identifying any facilities that need further investigation, and we will be carrying out massive preemptive testings as well. And we are going to also intensify quarantine measures for these cluster groups as well. And as for the nursing homes, please get tested as soon as possible if you have symptoms, and also wear your face mask if you are working at these nursing hospitals, and also refrain from going to any social gatherings, and also have a strict compliance to other quarantine measures. And the third risk is the fact that we have the new variants being reported across the world, and we are seeing an increase of the countries that are reporting such new variants. And we also seen here in South Korea the spread of the new variant through family members. And right now, as for UK variant, we have 15 and one variant stemming from South Africa. So we have a total of 16 new variant cases, and there are no additional cases reported as of further than that. And as for these new variants, we will be intensify our monitoring. And as for those who are coming in from Britain and South Africa, regardless of their PCR negative document, we are going to also make them have the tests of the PCR when they arrive in Korea, and we will also intensify our monitoring for the new variant as well. And as for those who are coming into Korea, and if you also live with your family members while you are on self-quarantine, please comply with the quarantine measures so that you do not spread the possible virus to other family members. Last but not least, we have the seasonal aspect. In particular, from last week, we are seeing a very cold weather here in South Korea, and we are seeing an increase of the congregation to indoors. And we believe that in this crowded spaces and confined spaces, it is very easy for the virus to spread. So we ask you to ventilate your space on a regular basis, and this is recommended for your households as well. And moreover, if you use heaters or air purifiers, please refrain from directing the air directly to people, and also make the power very weak as well, and also have natural ventilation every 2 hours. And as for multi-use facilities, please disinfect your area and also ventilate your space by opening windows and the door as well. And also ventilation is very of utmost importance as well at these multi-use facilities. And the quarantine authorities will also like to continue to note that we will be intensifying our epidemiological characteristics, and therefore we are asking you to refrain and take particular precautions if you are using multi-use facilities. And so right now we have done some investigation in the cluster infections that have broke out earlier, and they were also very dangerous when people did not wear face masks, also when people stayed at these facilities for a very long time, and when people were engaging in very respiratory droplets traveling behaviors as well. And they include cafes and saunas and indoor sports facilities, especially where you cannot wear a face mask. And also when you are staying in these facilities for a very prolonged time, or if you are eating together and dining together. So these could also increase the risk of the spread of the virus. And if you also visit diverse multi-use facilities and venues, we believe that this is also another risk factor. And also exposure to the virus could also come from using multi-use facilities like locker rooms and so forth. So in order to reduce such risks, we ask you to always wear your face mask when you are at multi-use facilities, and also refrain from taking off your masks aside from when you have to consume food as well. And if you can choose your location and venues, please go to places that have great ventilation facilities as well and have a great distance among others. And next, we would like to provide you some update on the influenza outbreak here in South Korea, and we are seeing that our threshold of influenza virus, as per the ratio of the influenza virus being detected among the outpatients, we are seeing it below the benchmark. And also globally, with the WHO, according to the WHO statistics, we are also seeing a lower than average influenza virus outbreak, standing at about 1.15. And we are also intensifying our procedures and preparations for vaccinations here in South Korea. And we also have mandated the ordinance under the Prime Minister and to launch the pan-government vaccination preparation team. And this team, we also have diverse departments, 4 departments and 10 teams. And we also have a special experts personnel in charge of these vaccine supplies. And we will also work closely with other government ministries to make sure that we are fully prepared for the vaccination. And we are also going to put in place a consultative body where the people could also gather their wisdom together. And we will also speak to our private and medical sectors as well. And during this week, we will also have the first meeting of this preparation team, and we will provide detailed guidelines for the government's ministries' responses and their obligations as well. And in order to intensify our pan-government efforts, we will be carrying out regular discussions and negotiations as well. Moreover, according to the Infectious Disease Law Prevention Act, we also have special committees in charge of vaccination as well as compensation and so forth. And aside from them, we will also have a special and separate committee on the vaccine preparation, which will be prepared very soon. And we will also talk closely with the medical associations, including Medical Doctors Association and nurses. And we will also facilitate a close communication with these medical experts as well. And as for the details, on the 8th of January, we have reviewed this by the experts, and we will be revising these guidelines and the details, and the finalization of the final guidelines will be provided sometime this month as well. And as for the high priority group, we will be also devising the details very soon, and we will be expanding the subject of the vaccinations to the entire public gradually. And also we are seeing the size of the high priority group, and so that we have no hurdles in preparing for the inoculations. And as for the high priority group, we are providing the subgroups as well. So we believe that these numbers will be subject to change. And as for the details, we will be providing you the details very soon upon the finalization of the details. And these exact numbers will also be disclosed then. And the year-end holiday quarantine measures have been intensified, and it has been prolonged, extended. And to this end, against COVID-19, we ask you to comply with the following 3 quarantine aspects. So first, we ask you to refrain from having social gatherings. Please stay home and also switch all of your meetings and religious gatherings to non-face-to-face means. And regardless of where you are, please wear your face mask at all times. And third, if you have any suspected symptoms like fever or respiratory symptoms, please get tested as soon as possible. Thank you very much.
네. 다음은 오늘은 코로나
Right, that was Seong Young with Monday's afternoon briefing. So what did she have to say?
Let's begin with the daily average of COVID-19 cases in the past week, which stood at 738, and that is down by almost 200 from the previous week. But despite the decline in infections, Tong said that there are still risk factors such as untraceable cases, and also the spread continues at high-risk facilities. In fact, out of 10 new cluster infections that were detected last week, 4 happened at medical facilities such as nursing homes. And another risk factor is the COVID-19 variant, as Korea so far has confirmed 15 cases from the UK and 1 from South Africa. Last but not least, she also mentioned that vaccine preparation is in full swing with a task force meeting to kick off this week.
All right, so that's good to know. Thank you for that.
Thank you.
Right, up next, we share with you details about COVID-19 vaccines as disclosed by those who've been inoculated. Do take a look.
The long wait for a vaccine was brought to an end in December as the world's first mass immunization campaign kicked off in the UK. However, according to a December survey by Pew Research Center in the US, around 40% of the respondents said they would not get a COVID-19 vaccine. The poll results reflect a high level of vaccine hesitancy over lingering safety concerns. The fears have been aggravated by misinformation, such as unfounded rumors claiming that a nurse had died after receiving a COVID-19 vaccine. We spoke to a colleague of the nurse in question to help clear the air on these false rumors.
She got up and did have a post-interview, and at that point she did clearly say that she has a history of overactive vagal response, and all the healthcare professionals do know that it really didn't have anything to do with the vaccine itself.
We also heard from several people in the US who were vaccinated to learn what their experiences were like. Dr. Justin Im is a healthcare worker who received the shot from Moderna.
Most common side effects are pain, redness, or swelling in the injection site, or systemically, chills, fatigue, or some headache. Personally, when I got the vaccine, pain was pretty bad in the arm, but after about 24 hours or so, it completely disappeared.
But what about the symptoms for Pfizer's vaccine? Are they any different?
독감 백신 맞는 때하고 거의 100% 그 정도 기분밖에 안 들었고 국소부위 아픈 것도 거의 없었고 그 이후에 열이 있다든가 근육통이 있다든가 부작용이 1%도 없었습니다. 만약에 부작용이 생기면 두 번째 보통 생깁니다.
So why are the symptoms more pronounced after the second dose?
COVID vaccine typically really works after the second shot, and that's why people have a lot more of these, so to speak, side effects or normal effects of the vaccine, because your body really builds immunity at that point in time.
As we wait for the first doses to roll out, what are some basic precautions to keep in mind before getting ourselves vaccinated?
The COVID-19 vaccine should be administered alone with a minimal interval of 14 days before or after getting another vaccine, such as the flu vaccine. Severe allergic reaction called anaphylaxis. Briefly, it's a life-threatening condition if you have had any anaphylaxis history in the past, or you have allergic reaction to any of these vaccine components. You should probably talk to your physician before getting the vaccine. Unfortunately, there's not enough data yet on safety of COVID vaccine on pregnant women and lactating women.
The government and the public must work together to speed up the vaccination process and achieve herd immunity.
You really need 70 to 80% of the population to be immune to COVID virus or any other spreadable infections. I may be introduced to COVID virus, but I won't get sick from it and I'll recover like that. And that way, I'm not carrying the COVID virus with me and able to transmit to other people. And then the COVID virus cannot be spread anymore.
So as long as we don't allow irrational fears to mislead us, we may be able to encourage greater public participation in the world's ongoing vaccination efforts.
올해는 남북이 유엔에 동시 가입한 지 30년이 되는 해입니다. 남북 협력만으로도 이룰 수 있는 일들이 많습니다. 코로나에 대응하는 과정에서 상생과 평화의 물꼬가 트이기를 희망합니다.
North Korea has reportedly asked for COVID-19 vaccines, and these reports have prompted questions about the potential situation up in North Korea with regard to the pandemic. Now, for more on this and on the future of cross-border exchanges, I have Professor Kim Jung from the University of North Korean Studies. Pleasure to have you with us, Professor Kim.
Thank you for having me.
And joining our talk virtually is Professor Park Ki-bom from Harvard University. Good to see you again, Professor Park.
Hi.
Right, Professor Kim, as we saw in the video earlier this morning, during his New Year's address, President Moon Jae-in proposed a joint inter-Korean effort against the pandemic. What are the prospects of a response from North Korea regarding this proposal?
Okay, for the President Moon, this is the last chance to sustain the dialogue with North Korea. So it is inevitable to propose this kind of the health cooperation. But as we know, the North Korea always decline this sort of the vaccine-related the cooperation. So I don't think this going to be some result in the good news between two Koreas.
I see. Meanwhile, North Korea's 8th Congress of the ruling Workers' Party kicked off last week, Professor Kim, and on Sunday, the Congress endorsed Kim Jong-un as the General Secretary of the ruling party following a revision of rules to reinstate the secretariat system that was scrapped back in the year 2016. What meaning does this move hold? And what are your thoughts on reports of a military parade in Pyongyang late last night?
So basically, this is the signal for two audience. First one is domestic audience. It is the some symbol of the power consolidation of General Secretary of Kim Jong-un in North Korea. That's the first signal. Second one is for the United States. This is the seemingly some provocation, but at the same time, Kim Jong-un want to have some dialogue with the United States with the upper hand. So that's the meaning of the military parade. On the other hand, the restoration of the secretary system is the returning to some traditional socialist state party system. So this is some sort of one instance of the normalization of North Korean political system.
I see. Meanwhile, Professor Park, according to the Wall Street Journal, North Korea has requested for COVID-19 vaccines from Gov'T, the Vaccine Alliance. Now, the request comes amid continued claims of no COVID-19 cases within its borders. Professor Park, what are your thoughts?
Yeah, so first of all, let me just be clear on this. I think North Korea has been successful in preventing the entry of the virus inside their borders. As you know, they started sealing their borders even before the Chinese locked down Wuhan and Hubei. We also know that North Korea has the testing capabilities, the gold standard, the PCR testing for COVID-19, but the capacity is limited. And they initially started testing only suspected cases. So when you show symptoms of COVID-19, such as fever and cough, which are pretty general symptoms, you would be quarantined and then undergo 2 separate tests, separated by 10 days. In October, probably they were able to get additional testing, and they instituted enhanced surveillance by testing certain asymptomatic people as well. So according to the North Korean Ministry of Public Health, they've tested over 12,000 people in this way, and none of the tests came back positive. And I actually happen to believe that there have not been any COVID outbreak inside North Korea. A key data point in this is the Party Congress, the footage which you just showed, just a minute ago. You saw thousands of people assembled, and none were wearing masks inside the hall. You know the North Koreans take the risk of COVID pandemic very seriously, and they would not have allowed the attendees to be maskless unless they were confident of their prevention measures. And lastly, many people, including certain news agencies, raise this question that if there's no COVID in North Korea, why would they even need a vaccine? And the answer is simple. They don't have COVID because they close themselves off from the world. This is not a sustainable situation, and they need a path to open. And obviously, the best way to open and the safest way to open is a nationwide immunization.
I see. And keeping what Professor Park has said in mind, Professor Kim, what are your thoughts, in fact, about the reality of delegates at the Congress? As Professor Park mentioned, they were pictured seating very close together, and they were without face masks. What are your thoughts on this reality?
So, as the Professor Park said, the Party Congress is the one of the most important political events for North Koreans, and this is also some very important events for the international audience as well. And because the General Secretary Kim Jong-un has emphasized that they have been a successful case for the containing COVID-19 pandemic. So based on this, some sort of the declaration of the strengths of the North Korea, this is some sort of the important signal for the international audience.
I see. Professor Park, now given the request for vaccines by North Korea, some predict the reclusive regime may secure doses as early as this coming spring. What would you say is an adequate amount of vaccines for North Korea, and what can you tell us about the infrastructure up there in North Korea with regard to possible storage and distribution of vaccines?
No, that's a great question. So let me try to explain a little bit about this COVAX facility, right? This was set up as a partnership between Gov'T, the Global Alliance for Vaccination and Immunization, and the World Health Organization. It was set up to ensure that poor countries in the world had equitable and fair access to the vaccines. Using contributions from rich countries, the facility aims to provide free vaccines to up to 20% of the population initially. The eligible countries, of which North Korea is one of them, they were asked to submit applications for the vaccines. North Korea has submitted its application at the end of last year. This should not come as a shock to anyone. Gov'T is the co-leader for the COVAX facility and the World Health Organization, and they've been working with UNICEF in North Korea for over a decade with outstanding vaccination rates for children in the 97-98% range across the country. So even if the first batch of vaccines are available by this spring, the recipient countries, such as North Korea, will need to demonstrate readiness for delivery before the vaccines are even sent. The good news is that North Korea does have adequate cold chain capacity to handle refrigeration requirements for the AstraZeneca COVID vaccine, not the Moderna or the Pfizer vaccine. The AstraZeneca vaccine requires storage between 2 to 8 degrees Celsius. This is simple refrigeration. We know that the BCG vaccine, which North Korea has been using for their children for over a decade, has identical cold chain requirements and is quite capable of maintaining these requirements. In fact, the shipment of BCG vaccine just arrived last summer during the lockdown through safe cold chain monitoring. And you also asked about the additional dose North Korea will need. Remember, the COVAX facility only provides 20% of the population. That's 5 million North Koreans. If the goal is to immunize the entire population, they would need 40 million additional doses, 2 for each of the remaining 20 million people. Roughly, this would translate to about $120 million cost if they were to purchase AstraZeneca vaccine, which is estimated to be about $3 a dose.
I see. Professor Kim, according to foreign media, North Korea has not only reached out to Gov'T, but it's also reached out to a few European embassies for vaccine support. But North Korea has yet to respond to South Korea's prior offer of assistance with regard to prevention and treatment efforts. What are your thoughts on this?
So first of all, we have to remind the fact that for North Koreans, the South Korea is our rival in the Korean relations here. So it is very hard for especially the Secretary General Kim Jong-un to willing to accept the offer from the South Korea. At the same time, the other potential source for the vaccine is China. But as we might know, North Korea, especially in terms of economy, North Korea is too dependent upon the Chinese market. So it is very, risky situation for the North Korean to get the vaccine assistance from China. So considering these factors, then for North Koreans, it is rather safe and some sort of the politically secure to get some cooperation from the international organization or the European countries. That's why the North Korean try to get some vaccine assistance from those sources.
Right. Professor Kim, during its Congress, North Korea reportedly claimed that COVID-19 collaboration between South Korea and North Korea is a non-essential issue to improving inter-Korean ties. But do you suppose collaboration on the vaccine front may change the stance?
Once again, the Secretary General Kim Jong-un already declared on the front of the party Congress that this is non-essential part of the cooperation. And they also argue that the goodwill for goodwill or the hostility for hostility exchange principle. So for the North Korean, especially the leadership of North Korean, it is important to get some concession, not in terms of the health cooperation, but in terms of the military front, especially for example, the canceling of the joint military exercise scheduled in this March. So that's the most important thing. So in that sense, I don't think there's some promising event for the health cooperation between two Koreas.
I see. Meanwhile, Professor Park, should vaccines be available across the border, what are your prospects with regard to COVID-19 in North Korea in the months ahead?
Right. I mean, listen, vaccines are incredibly important and it will save lives, but it is not 100% effective. We know that. And now with the new strains popping up, it's even more concerning. So I expect the North Koreans to calibrate their reopening carefully against existing risks.
I see. Professor Kim, North Korea's Kim Jong-un has urged South Korea to put into practice the cross-border agreement reached earlier. Now, in prompt response, Seoul's Unification Ministry claimed that South Korea is sincerely devoted to implementing the bilateral accord. What agreement is being referred to here, and how will Seoul's active devotion to it perhaps affect the future of inter-Korean ties, do you suppose?
So basically, it refers to the military agreement as well as the economic cooperation agreement. So that I think the North Korea now want to get some sincere concession from the side of South Korea. That's the initial condition for the resuming the inter-dialogue between two Koreas. So in that sense, I think the North Korea now set the somehow higher bar for the South Korean government in order to implement this kind of some promise between two Koreas, especially in terms of the domestic audience in South Korea, because the South Korean the audience is now not so favorable for the inter-Korean cooperation issues here.
I see. Professor Park, speaking within your capacity as a medical professional, what form of cross-border healthcare assistance is of utmost importance to aiding North Korea's COVID-19 containment efforts, do you suppose?
Yes, Sunny, medical and health cooperation among countries is absolutely critical in fighting a pandemic. No one is safe until we're all safe. And it makes a lot of sense for the two Koreas to cooperate during the pandemic. But like the Professor Kim just mentioned, we cannot ignore the fact that the two Koreas are still technically at war, and military tensions on the peninsula and beyond make inter-Korea cooperation really subject to very powerful geopolitical factors. So until these factors improve, the two Koreas can and should cooperate through key international organizations of which they are both members. This includes WHO, UN, COVAX, and UNICEF. And South Korea has massive technical and financial resources that they could provide. And all these organizations already work in supporting North Korea with COVID.
I see. All right, Professor Park, as always, thank you very much for your insights. And Professor Kim here in the studio, thank you for your time. Right, well, the pandemic has not simply halted cross-border exchanges. It has ground to a halt our sense of normality, one that health authorities believe can be restored if we abide by safety precautions. We'll be back with more COVID-19 coverage tomorrow. In the meantime, thank you for watching.
Korea is in the midst of its third wave of COVID-19. Frontline medical workers are fighting COVID-19 in the freezing cold. They warm their icy hands with space heaters and portable hand warmers. Several districts are renovating their testing sites to provide shelter from the cold for medical workers. To ensure that their hard work and sacrifice do not go to waste, let's remain socially distant this holiday season. Overcoming COVID-19 together. Let's all stick to the basics. Did you get a chance to watch the revamped show? It's all about diplomats residing in Korea and their special stories. Each ambassador has different responsibilities.